New developments tonight in a massive Medicare fraud investigation that the CBS News Texas I-team has been tracking for months. What started with suspicious charges on seniors' Medicare statements led us to a small Austin office. It is now linked to a multi-billion-dollar international fraud scheme. This thing is huge. And this man, who I'm going to show you in a photograph, just named in the case, was just brought back to the United States after being captured overseas. Bring investigative reporter Brian New into the picture now. So talk to us about not only who he is, but how big this thing really is.
Doug, this is what we suspected all along, that the one Texas company that we discovered that was stealing from Medicare and private insurers is just one piece of a much larger criminal fraud operation. When we walked into this North Austin office 6 months ago,
hi, how are you?
We saw the alleged operation up close. Boxes packed with medical and insurance records, and two employees who told us they knew nothing about what was going on.
Oh, wow.
So this is all news to you?
Yes, I did not know.
Listed as a medical supply company, prosecutors say Centurion Medical was actually a shell created for the sole purpose of defrauding insurers. The first person tied to this alleged operation was Nika Machudazi, but we now know he wasn't working alone.
Over the weekend, we conducted the foreign transfer to custody of a defendant who is allegedly connected to another $3.7 billion in intended loss.
This week, the Department of Justice announced a nationwide healthcare fraud crackdown, charging more than 450 defendants, including this man, Ibrahim Hilmi. He was arrested in northern Cyprus, then flown to Miami to face federal fraud charges. Prosecutors say Hilmi and Machudazi were a part of the same criminal network. Court records show Machudazi briefly took control of a Florida company registered inside this South Florida office building. Then ownership shifted to Hilmi. Prosecutors say this back and forth was intentional, designed to hide who was really running the scheme. It's the same playbook we uncovered here in Texas. Investigators say the group would take over small medical supply companies, swap out names on the paperwork, then bill Medicare for urinary catheters that patients say they never ordered or received.
When I first got the notice from my husband from Medicare summary, it had the charges, and I said, "What the hell is this?"
Seniors told us they only discovered the fraud after opening their Medicare statements.
There were no doctors. We never went to any doctors for this. They just paid it out. Nobody checked.
In January, the FBI tracked Machudazi from his Austin apartment and arrested him before he could flee the country. Hilmi managed to flee the U.S., but he didn't get far. Now, in total, investigators say this network submitted more than $3 billion in fraudulent claims, making it one of the largest Medicare fraud cases, Doug, that they have ever seen.
Brian, I've watched. You've been reporting on this type of fraud for more than 2 years. Before this, it was other shell companies. But the bottom line is anything actually being done to stop this as we look forward?
Yeah, federal prosecutors say yes, and they say that these arrests show that their new approach is working. For years, they told us the system was pay and chase. Claims were paid first, investigators then try to recover the money. But that proved to be ineffective. Now the Justice Department is using real-time data analytics to spot fraudulent claims, Doug, before any of the money goes out the door.
All right, Brian New, I-team, thank you so very much.